bigger, meaning that we are having some kind of pathology. However, it fully depends on our T wave. The U wave direction should be the same as the T wave direction in the lid. And U waves are prominent at slow heart rates and usually best seen in the right precordial leads always. Questions regarding the U waves. As you see here, this is our U wave and it should be 1/3 of our T wave. And it is like, let's say, the sum of the T wave. It should be smaller and always the same direction as we're having the T wave. So if we want to check the U wave is right or not, we are first of all checking the T wave, and then judging on the T wave, we're checking the U wave. Okay? Okay. Questions? No questions. Now, talking about the P segments and intervals. We've discussed P wave, Q, RS, T, G wave, and U wave, right? And we're having different intervals and segments, and we're having PR interval, RR interval, which is really important and really crucial for us. We're having ST interval, TP interval, and QT interval, right? And now let's discuss what they are and who they are. So when we're having PR interval, it is starting from the P wave till the start of the QRS complex, and as you see here, PR interval, it is starting from the P wave until the start of our QRS complex, right? Our PR segment will be from the end of our P wave and the beginning again of the end of our T wave, and we're having TP interval. It is from the finishing of, like, ending of our T wave and starting of our P wave. Okay. ST segment, it is like finishing of the S wave and starting of the T wave. And as you see, these segments are on the isoelectrical line, right? And this is crucial that they should be on the isoelectrical line. If we are having myocardial infection, MI or angina pectoris, for example, it depends on if we're having them ST segment elevation and without ST segment elevation. I will show why we're checking that. For example, see, this is our normal ECG, right? I will just put it there to make it bigger. As you see here, this is our normal ST segment, right? And it should be on the isoelectrical line. However, when we're having ST segment elevation, it's not on the isoelectrical line at all. It is above, right? Meaning that we're having myocardial infection already. That's why it is important that, like, the ST segments should be on the isoelectrical line. Yeah, we already discussed that. Now let's talk about the duration of these segments and etc. So when we're having a PR interval, it is measured, as we mentioned, from the beginning of the P wave till the first deflection of the QRS segment, right? And it normally lasts around 0.12 till 0.20 seconds, and it is around 3 to 5 small squares on the ECG paper. Then comes QRS interval. It measures from the first deflection of the QRS complex till the end of the QRS complex as isoelectrical line. And interval lasts should between 0.08 and 0.12 seconds. It's around like small ECG quadrants. And as you see here, like, this is our normal PR segment. For example, it will be prolonged in the AV block, or it should be lesser in the VPV syndrome. We will study these syndromes in your clinical years. For example, here QRS interval is normal. It should be less than 120 milliseconds. In the right bundle branch block, it will be like bigger than it's normally, because we're having the block there and impulses cannot be generated more. Normal QT interval, if we're having shorter QT interval, it is like either, for example, hypercalcemia, or when we're having prolongation of them, we're having some kind of drugs, or hypocalcemia, for example. When we're having PR interval long, like we might think that there is some kind of heart block, or when it is short, we're having Wolff-Parkinson's syndrome, what I mentioned already. Now, I have not talked about error segment, right? Error interval. Because that's really crucial for us to calculate our rhythm of the heart. So error interval represents the amount of time between the heartbeats. Thus, the error interval is heart rate dependent, right? In fact, most of our methods to determine heart rate on the ECG are dependent on the measuring of the error interval. For example, if there is 0.6 seconds between the beats and there are 60 seconds per minute, then the heart rate would be 100 beats. Why? 60 seconds on minute divided on 0.6 beats, for example. I will jump to the calculation of the error interval and then come back. So when we're calculating, for example, our heart rate, we are like normal formula, how it is easier for all doctors to calculate it really easy. It is to use like 300 divide the number of the big squares between the error interval. Or we can calculate like 1500 divide of the number of small squares. It will be 150. 3 boxes, it will be 100. 4 boxes, it will be like, we will move it here, it will be around 75. You understand how I'm calculating that? Okay, now let's do another ECG. Okay, here. This is one interval and this is another error interval. I will put it there. Can you tell me what will be the heartbeat rhythm? Can you tell me what will be the error interval rhythm? Like, these are the errors, right? We're having 1, 2, 3, 4 quadrants. 70? Yes, 75. Because it's really easy to calculate, we are choosing 300 divided of the big square between error interval, and 300 divided on 4, it will be 75. Clear? Okay. We can have like another rule, it is called 10-second rule. At the most ECG recorded 10 seconds of the rhythm per page. One can simply count the number of beats present on the ECG and multiply by 6 to get the number of beats per second. So number of waves in 10 seconds strip multiplied on 6, and it really counts on when we're having irregular rhythm mostly. Okay. For example, here, count QRSs in 10-second rhythm strip, and we are multiplying it on 6. Use this method to determine the rhythm in the irregular, for example, atrial fibrillation. Yeah. Like mostly, if it is closer to the end, we are counting as a one whole. For example, here, see, it is like not in the middle. We like if it would be here around, we would count like minus like that half. Here we will count like plus 4. 1, 2, 3, and 4. I will count as a 4. It directly in the middle, it won't be like that normally, but like depending on you. Then we're choosing not this quadrant, but like another one, okay? Like this is, you are seeing just like small strip, right? Like this, but in reality you are getting like the whole paper, like roll of the ECG. So you are choosing the one quadrant which is always like the closer to either isoelectric lines, okay? The idea, one more thing, the idea here it is that, like, first of all, before counting that, you should check like the multiple error segments to see if the quadrants amount are the same. Because when we're using 300 divided on the quadrant amount, it should be like all the same. If it is not the same and we're having some kind of pathology like atrial fibrillation, we are using this rule, okay? 10 seconds, multiplied on 6, yeah. Questions? Yeah. This one? It is like the same as 300 one, but like see, 300 it is for bigger quadrants, and 1500 it is just to calculate smaller quadrants. It's the same, and we are using it when the rhythm is like same, meaning the distance between error